Loa loa, commonly called the African eyeworm, is a filarial nematode that infects humans. Transmission occurs through the bite of day-biting chrysophiles, which act as the disease vectors. Adult worms are slender and whitish. Males measure about 30 to 34 millimeters, while females are larger, reaching 40 to 70 millimeters. The microfilaria are sheathed, around 250 to 300 micrometers long, with nuclei that extend all the way up to the tail tip, which is a key diagnostic feature. The life cycle begins when infective L3 larvae are deposited onto the skin during a fly bite. These larvae penetrate tissue, mature into adults in the subcutaneous layer, and females release microfilaria. The microfilaria circulate in peripheral blood during the day and migrate to the lungs at night. When flies ingest them, they develop into L3 larvae in the thyroid muscles, migrate to the proboscis, and transmit it to a new host.
Moving on to the clinical manifestation and mechanism, loa pathology is primarily driven by adult worm migration and the host immune response. A hallmark sign is scalable swelling, which are itchy, non-pitting transient localized angioedema, typically on the extremities. This occurs because of the host immune system react hypersensitively to the metabolic product of the migration worm. We also see the striking ocular migration, where adult worm visible across the subconjunctiva, causing intense pain and congestion. Finally, microfilial migration beneath the skin triggers severe pruritus or intense itchy.
The epidemiology of the loa worm represents a critical public health challenge confined to the more rural rainforests and swamps of West and Central Africa. Spread by the day-biting deerflies that breed in muddy, shaded streams, this parasite has chronically infected up to 20 million people across medium to high transmission zones. Furthermore, 42 million people live at continuous risk of infection, divided almost equally between 20.5 million in high endemic zones and 21.7 million in intermediate zones. Severe impact of this disease reveals a profound public health crisis with a disability morbidity rate of approximately 413 per 100,000 residents, which exceeds many other infectious diseases on the WHO's neglected tropical disease list. Tragically, this physical toll is also accompanied by a severe mortality risk, as the total death fraction reaches an estimated 14.5% in high endemic areas, underscoring the urgent need for targeted intervention.
For accurate diagnosis, specimen timing is critical. Loa exhibits strict diurnal periodicity, meaning microfilia only circulate in the peripheral blood during daylight hour, perfectly aligned with the daytime biting habit of the Chirops vector. Therefore, blood must be collected strictly between 10 a.m. until 2 p.m. Conventionally, we process this via GM-sustained, take blood smear for quantification, or use concentration method like knot concentration and membrane filtration to lyse red blood cell and isolate the microfilia under microscopy. To overcome conventional limitation, modern molecular diagnosis offer an alternative. The LMP method provides isothermal amplification, making it faster than PCR and ideal for field setting without thermal cycler, while traditional PCR assay offer unmatched sensitivity to distinguish loa from the co-endemic parasite. Most innovatively, the smartphone-based loa scope automatically quantify microfilia under 2 minutes at the point of care. In comparison, while conventional smear are highly cost-effective and field accessible, they lack of the sensitivity needed for the low-density infection. Molecular tools provide superior accuracies, and mobile tech like loa scope bridge the gap completely, allowing rapid screening to prevent adverse drug reaction during mass administration.
In contrast, conventional diagnostic methods include direct visualization, such as observing adult worms across the conjunctiva or migrating under the skin, sometimes accompanied by caliber swellings. Microscopy is also key. Daytime blood smears collected between 10 a.m. and 2 p.m. reveal circulating microfilaria, while scent smears with jasma or hematoxylin highlight the sheath and nuclear pattern, confirming loa infection.
To conclude, prevention of this disease is important because it inflicts a heavy physical and also socioeconomic burden to vulnerable populations. Effective prevention, diagnostic screening is vital to protect these vulnerable populations and communities during mass drug administrations for other disease, as individuals with high loa microfilae counts are at serious risk of suffering severe reactions if treated blindly.